Hi there, I'm Dr. Dana O'Neill, your family chiropractor. Today's segment, we're going to talk about hip pain, specifically right in the hip joint. What to do to prevent it. If you are having hip pain, what to do to prevent hip replacement surgery. So there's so much we can do to keep the joints healthy. First off, a little anatomy there. As you can see, there's a little shallow cup that hip socket rolls in. What we don't see is there is a large cartilaginous rubbery labrum, it's called, that kind of acts like a suction cup, wraps around that hip, holds it in. So beyond the bony ridge, there's a good ½ inch, 3/4 of an inch of a cartilaginous labrum that holds it in. That is very important to keep it nutrition to it, lubrication to it, to keep it healthy. Range of motion, exercise, yoga, all that helps. Now, from a chiropractic standpoint, when someone comes to us with hip joint, we're going to look at the whole spine, of course. We're looking at if there's one leg shorter than the other. We're going to look at the alignment here in the lower back. We definitely have to have a good nerve supply to all the surrounding muscles and the structures in there. We also want to make sure the sacroiliac joint's moving properly because it all works in unison. If this is locked up and the hip's having to do all the work, it makes it wear and tear faster and degenerate faster. From a nutritional standpoint, this is very important because it all ties together. And what's one thing that's not going to fix it, one thing's not going to damage it, is usually when we're having multitudes of problems. So from a nutritional standpoint, glucosamine we hear is good for joints. It's called joint juice, shark cartilage, things like that. Chicken soup is full of glucosamine. So is beef broth, seafood jambalaya, all these traditional dishes are full of that stuff. And when we eat it and we're grinding a joint and it needs cartilage, it just pulls it out of the food stuff and rebuilds the cartilage. That's what it's supposed to do. But if we're not eating enough of it and we're grinding the joint, well, the worst thing we can do is take aspirin to hide the pain. Aspirin or Tylenol, Motrin, or arthritic medication. Anything that's hiding the pain is bad news because it's going to make the joint degenerate faster because it works. It hides the pain. How many of us would take aspirin for 10, 15, 20 years for a toothache? Same thing's going to happen. The tooth's going to rot out of your head. Your joint's going to rot or degenerate prematurely. So you need to get off all the medications, the aspirins, Tylenol, things like that. There's nutritional anti-inflammatories you can do. Turmeric, ginger root, things like that are helpful. Get to the chiropractor, make sure all the joints are moving properly. You got good nerve supply, that side joint's moving normally, legs are balanced, exercises like bicycling, swimming, things like that are so much more better than even walking or any type of trauma. And that's why we like to say from the chiropractic world, when your spine's in a line, you'll feel fine.